So Obamacare is actually having effects that were not intended, or were they? This week, the White House said it's a good thing that Obamacare creates a disincentive to work, and apparently the Washington Post and many others in the press agree. Watch this as a flashback this week. This is Doug Elmendorf of the CBO on why Obamacare creates a disincentive to work. Watch.
By providing heavily subsidized health insurance to people with very low income, and then withdrawing those subsidies as income rises, the Act creates a disincentive for people to work relative to what would have been the case in the absence of that Act.
But this is an extra choice people have, and that's not making somebody worse off to give them an option they didn't have before.
When somebody decides for himself or herself not to work 64 hours, but to work instead for 35 hours, they're making a choice about their overall quality of life.
Yeah, they are. And guess who's paying for it? You are. So it's actually not that simple. Like, I would like to make a choice to work 30 hours a week.
Well, this happened very quickly. The CBO report came out one day, and very quickly the White House went in to spin it into something that they tried to make it sound like a positive.
Right. So the report, for those of you who weren't paying attention, the CBO comes out. By the way, it's bipartisan. No one really questions the political bias or accuracy of a CBO report. They're pretty straightforward. It says 2.3 million jobs, full-time jobs, or their equivalent, will be lost because of Obamacare. And the White House, as you just said, well, that's good.
Yeah. And regardless of whether you're saying that people are choosing to quit and that's why the jobs are gone, or regardless, it's still the number is the same. 2.3 million jobs will be gone within the next decade. So then, who pays for that? Also, that's out of the tax space as well. So, where's the money going to come from next?
Well, some people are excited about it. I mean, the Washington Post interviewed a number of people who've left their jobs voluntarily because they can, because the rest of the country is subsidizing their health care. And so they decide, why am I working so hard?
Right.
I shouldn't. I take time for me.
But where's the choice of the people who now end up paying for those people who quit their jobs? I don't have a choice.
Yeah, well, there is none. There is none clearly there. There is something to be said for some people who have things that they would like to invent, business they would like to create, that possibly they can leave now and get their health insurance in another way. If they're going to go on to do something that's productive and creates jobs and provides for themselves. But I think at the bottom line, the problem here is it makes no sense to be providing incentives for people to quit their jobs.
So what you're saying is, to uncouple health insurance from a specific job is probably useful, but it's not useful to force other people to pay for people's
And I'm
idle
saying
time.
that in some cases, but the byproduct of that also is a huge amount of people who will just choose to stop working because they can now, and they can get more subsidies off of the tax
this should not be surprising to us. Betsy McCoy-Ross, who's been looking at health care for 20 years, since Hillary Care, back in 1993, had this to say about Obamacare, and says this was the plan all along. Watch.
They want people who are working to get health benefits to be able to quit their jobs or reduce their hours and go on the Obamacare exchanges and have the taxpayer pay for their health plan instead. And that's exactly what's happening here. So the agenda is less personal responsibility and more taxpayer dependence. And I say taxpayer dependence because government doesn't have money. It's coming out of your pocket and mine.
But the best part of this is, so now that all these people have dropped out of the labor force, the White House says, well, we have a labor shortage. We need more low-skilled immigration. So to replace people who've dropped off of roles because they either can't find jobs or decided not to work, we need to replace them with people who will work cheaper from other countries.
Yeah, speaking of jobs, though, I like what Michael Goodwin had to say in his op-ed. He said specifically, quote, "We now have it straight from the White House and Congress that creating jobs is not really their goal. Instead, the president's singular piece of legislation is a success because it helps people get health care while avoiding work."
Right. So it helps people leave the workforce, and that's a good thing. I guess this is what they're left with. If you can't create jobs and they've proven unable to, I guess you're left with this. Speaking of irony,